This is the official launch of our work on employee effectiveness and wellness within our Clinton Health Matters initiative. We work on 3 key strategies. One is building strategic partnerships like we're doing today to really help facilitate the movement and scaling of health promoting solutions, to really pull people together and activate people to identify what they can do from a commitment perspective to really make a difference and contribute to the health and wellness of others. We do that cross-sectorally. We are really excited to have strategic partners who come from faith-based organizations, non-governmental organizations, business, industry, individuals, healthcare, technology, and I'm just naming a few, who have really come to the table to be a part of the solution. We believe that all of these partners are really instrumental in making a difference. And we work at the community level to really help build those multi-sectoral partnerships at the community level to transform health and wellness overall. And then are also working to leverage innovation, technology, digital platforms to advance health and wellness. We're here today because we know that adults spend an inordinate amount of time at work. All of us in this room spend a lot of time at work, and it's a really important environment for us, and one that can really be influential to one's overall health and well-being from a variety of different factors. We also know that it's an area where we can really close some of the inequity and disparity gaps by virtue of impacting workers of different socioeconomic levels. The why, the business case for making this happen is that, as probably all of you know, the unwell workforce annually is estimated to cost $153 billion right now, and is set to rise to $1.2 trillion by 2023, and 5.668, to be specific, trillion by 2050. And we also know that estimates show that for every dollar a corporation or company spends on health and wellness, there's a $3.27 return on investment. So there's a good business case to make this happen.
As part of any good strategy, I think there are 4 additional elements that are important to look at. One is having health education, tools and resources for the employees and families, making sure that we're doing adequate engagement and getting the right engagement from our population through incentives. It's important to have really good internal communication so our population really understands what is the strategy, what are we trying to accomplish, what tools and resources are available to them, and what are we hoping to achieve. It's also important to note that while we as the employer have a responsibility to provide all of these tools and resources to our population, that employees also have to take their own personal responsibility and accountability for their health, and really working in a partnership to make sure that that occurs. And then finally, we're always continuing to benchmark with best-in-class companies to make sure that what we're doing really is on the cutting edge.
Our dream at Humana is to help people achieve lifelong well-being. We define well-being by 4 pillars, and that's purpose, belonging, security, and health. And so we really sort of set out, and we partnered with Discovery Health out of South Africa to implement a program called Humana Vitality. It truly is a rewards and incentive program, but unlike traditional wellness programs, it really is predicated on verifiable results with underpinning around actuarial science and behavioral economics, which means essentially that the way the program is structured is self-motivating. How can we create a closed-loop environment whereby the practicing physician not only knows about the care that I've seen him for or her for, but also about the gaps in care that I have. And so we actually produce reports that are available to the provider community that says that if I have diabetes and I haven't had my eye exams, at the time of that subsequent appointment, there's a gap of care alert that comes on to the physician's screen. Additionally, they know how much I've been engaged in clinical programs because we provide that information to them. And finally, they also know what I'm doing around wellness. So around the Humana Vitality program, it's driven by status level. And so if I'm disengaged in the wellness offering, it will show my status and the fact that I'm either blue or bronze. And if I'm actively participating and I've set goals around Humana Vitality, that treating physician would also have access to what my goals are. So as part of the conversation then, not only are they able to talk to me about the underlying reason I'm there, but also to help encourage and inspire health and well-being around where my goals are within Vitality and how I'm progressing towards the achievement of those goals.